Hello, my name is Denise Como. I am presenting my policy action plan for healthcare policy and finance as part of the Doctor of Nursing Practice program. Contents of this presentation include an overview of the policy, background, stakeholders, advocacy plan, which includes educational activities and communication, and a conclusion. The impact of healthcare policies on community health in the United States can be significant, either for better or worse. The North Carolina Section 1115 demonstration waiver for North Carolina Medicaid services is up for expansion, and renewal is one policy that can benefit the citizens of North Carolina. The policy aims to provide services for low income and disabled individuals through a managed care model. It emphasizes person-centered care, including healthcare, food, housing assistance, and employment support. The expansion also focuses on better transition services for those released from incarceration and individuals with substance abuse disorders. Additionally, it considers including those with brain injuries to address social determinants of health. The background of this waiver is North Carolina applied to the Centers for Medicaid Services, or CMS, for a waiver in 2016 to transition the program to a managed care model instead of fee-for-service, which was approved in 2018 by the Centers for Medicare and Medicaid Services. The waiver is due for renewal application in November of 2024. The new application includes the expansions of services to incorporate addressing more of the social determinants outside of medical services that impact whole person care. Discussions and negotiations are still being considered for definite inclusion in the policy for expansion application for the continuation for the next 5 years if approved. CMS's next step is to review the application with the new additions and the effectiveness data from the previous expansion period. Once reviewed, there will be a comment period for the public to weigh in whether there is support or objection to the proposed new initiatives. So, who are the stakeholders for this policy? The policy can provide resources to address the social determinants of health for vulnerable members of society. The stakeholders encompass a wide array of individuals and organizations. Medicaid beneficiaries are the primary group that would be positively impacted by the additional support proposed. Healthcare organizations and providers have a vested interest in this reform due to its potential to increase reimbursement and the ability to coordinate care using managed care. Government agencies such as policymakers and the federal government are responsible for aligning the waiver and ensuring the budget and policy enforcement to achieve the proposed objectives set forth by the changes. Advocacy groups that champion mitigating determinants of health play an important role in advocating for changes to progress society's support of vulnerable populations and individuals. So now we'll talk a little bit about the advocacy plan. Advocacy for support of the waiver includes an educational activity offered to registered nurses employed at the organization's rehabilitation hospitals. Education will be provided about the North Carolina Section 1115 demonstration waiver for North Carolina Medicaid services. Education will include the key topics and the impact of the policy, such as the waiver, which includes transitioning to a managed care model to coordinate healthcare services. Person-centered care addresses more than healthcare services and includes food, housing, employment assistance, which impacts the whole person. The expansion also aims to provide better transition services for newly released for incarceration and those with substance abuse disorders that often do not benefit from the public and governmental assistance policies to prevent relapse in conditions or to end up back in incarcerated again because of lack of resources. One aspect that is also being considered is including those with brain injuries, which is one of the specialty programs at our rehabilitation hospitals that can involve young individuals who lack resources to maintain health. All these areas are essential in addressing social determinants of health and will be included in the educational activity. Communication and education about the policy is one way to truly advocate for change. Another advocacy intervention includes communication, which will be a policy brief shared through email and posted in staff lounges to communicate the details of the waiver to those who can benefit from the change to the policy. Communications for the open comment period from CMS to support the approval will also be emailed and posted in staff areas to encourage active advocacy for the change. Continued updates will be sent to the nursing team about the legislative decision and what results and impact the change has seen once approved to reinforce the impact supporting for public policy from nursing professionals can have on our community. And this slide is the policy brief that will be sent out to everyone. It provides a one-page summary of the policy, the overview, background, and why the support is needed for the expansion, which includes addressing social determinants of health, provides whole person resources for historically underserved peoples, benefits society by provision of employment assistance, housing resources to decrease the burden of homelessness on the communities, and the assistance for previously incarcerated to reduce the rate of recidivism, which all has a major impact on society in general. So, in conclusion, healthcare policies like the North Carolina Section 115 demonstration waiver for Medicaid service can significantly impact community health by improving access to comprehensive, person centered care for vulnerable populations. The proposed expansion and renewal of this waiver represent a crucial step in addressing the social determinants of health, enhancing the well-being of North Carolina's Medicaid beneficiaries. By focusing on managed care, translational services for those released from incarceration, and support for individuals with substance use disorders and brain injuries, the policy not only aims to improve health outcomes, but also seeks to promote equity and reduce disparities within the healthcare system. Effective implementation and ongoing stakeholder engagement will be vital to realizing these benefits, ensuring the policy continues to serve the needs of North Carolina's most vulnerable citizens. Thank you for listening to my presentation. My contact information is included below. If you have any questions, please feel free to reach out to me. And thank you.